Hello, and thank you for joining Engage Africa Foundation Festival 2022. This morning's session is titled Health Promotion, Misinformation and Disinformation in the Media. And I have some very seasoned public health professionals in-house today. Let me start by introducing Mrs. Wemimo Onikan. Mrs. Onikan is a communications specialist with years of experience in the nonprofit, public and private sectors. She has, over the years, led communications on campaigns addressing public health issues, including sexual and reproductive health, maternal and child health, and nutrition. She has also developed resources to increase behavior change on health issues and has worked with diverse media organizations to bring matters of public health importance to the fore. Mrs. Onikan holds a master's in strategic communications with a specialization in development communications and is a member of the International Association of Business Communications. And my next speaker today, my next panelist is Dr. Emeka Okorocha. Dr. Emeka Okorocha is an international media medic, an author, a TikTok star, and a frontline NHS doctor working in accident and emergency in hospitals in East London and Kent. Dr. Emeka has just written his first book, Your Health in Your Hands, a lifestyle handbook packed with simple hacks to help you live longer by future-proofing your life. Dr. Emeka produces a variety of inspiring, educational, and entertaining TikToks on topics like mental health, well-being, myth-busting, and Black Lives Matter. Thank you very much, Mrs. Onikan and Dr. Okorocha, for joining us today. Do you want to say maybe one or two sentences to introduce yourselves?
Would you like to go first, Mrs. Onikan?
Sure, I'm delighted to be here. I'm very excited to be able to bring some of my experiences, some of the knowledge I've gathered so far in my work in international development and particularly in the health space to this conversation. And I look forward to having an interesting time with you all today.
Thank you very much.
Yeah, thank you. I'd like to echo that. I'm really happy to be here. I'm very I think passionate about African healthcare, especially Nigerian healthcare and what we can do. And I'm happy to bring my services and my information that I've learned on the front line, working in COVID wards and working on the emergency unit, as well as doing a number of different campaigns here in England where I've spoken to young people about myth busting and misinformation and stuff I've done on the news. And to bring it forward here, I think is really important. I think the youth and the population in general need to know about misinformation and where to get medical knowledge. So I'm happy to be here and happy to take part.
We are so delighted to have you join us today. And thank you very much for choosing to be a part of this conversation, because we also believe at Engage Africa Foundation that healthcare is very important, and how we promote and spread health information is even very vital for the survival of people on the African continent. And if you don't mind, I would like to jump straight into it. And my first question that I would like both of you to answer is that we hear the term health misinformation a lot.
Yeah.
It's become a buzzword. So would you kindly, and I'll start with you, Dr. Okorocha, would you kindly define to us what health misinformation means?
Well, pretty much what it says on the box. Health misinformation is information spread via a number of means, via social media or online or by hearsay. And this is basically information which is factually not accurate or completely incorrect, or can just be lies or myths or jokes or rumor or anything of the sort that doesn't have any factual backing from any credible source or health organization, which hasn't come from any kind of study to prove it. So anything that's said where you can't reference it to a study or some sort of medical or clinical information or organization that's spread and about your health, this is basically health misinformation. So a lot of people, especially during the COVID time, who had myths about the vaccines and myths about COVID itself and the origins, and this information wasn't coming from the WHO, it wasn't coming from the CDC, it wasn't coming from PHE, Public Health England, where I am, and this information was spread, and we called this misinformation. And I think we're going through a little bit of an infodemic where a lot of information spread online and it's becoming more and more and more. And you can't really tell who's credible as a health professional who's spreading this information. That's why it's very important to know exactly who's talking. As in, something I say is going to be very different to someone something someone says where they may not have the experience I have or the learning and teaching I've been exposed to as a doctor. So that's basically information in a nutshell.
Thank you very much. And Mrs. Onikan.
Sure. So sometimes people can sort of, mix those words together. Often you would hear misinformation, disinformation, and you're wondering what's exactly the difference. So in the case where you could have misinformation, which is basically false information, misleading information, that can be out of context. But one thing that makes a difference is that it's not with the intention to deceive other people. And basically it could just be a mom who hears that, oh, for you to address COVID or Ebola, you should drink salt water or something, and not necessarily because she intends to deceive, but that's what she heard. And that's what, she continues to propagate because she thinks that that's the right information. So that is misinformation when, this out of context information there. And like Dr. Okorocha said, it could be information most of the time is not even from WHO, it's not even from CDC, it's not from any of the recognized health organizations, but somehow people propagate those myths and ideas, and then it now becomes the information that is spreading, right? But disinformation, on the other hand, is information. First, it's false, just like misinformation, but disinformation is there deliberately to alter the truth, deliberately to make people take the wrong steps, and then eventually has a lot of implications on people's health, and lots of people have died in the past because of things like this.
Yes, thank you very much, Mrs. Onikan, for bringing up this information, because that's what my next question is about, and I'm glad that you already broached the topic. So my question is, do you think people just deliberately go out of their way to spread false health information online? Like they know this information is false, and then they go out of their way to kind of spread it on social media? Do you think that happens? And why do you think that happens?
Me personally, I think people do it, one, because they have an agenda. So you even see some people when they're trying to make financial gain or financial profit, and they're trying to sell a product, whether it be a medical product or cannabis-based induced oils or something which they say can stop inflammation or stop anti-aging and this. And they know what their product is doing. They know what their product cannot do. And sometimes they will sell their product as if their product can do certain things that clinically haven't actually been proven, because they know that putting those buzzwords in saying it's going to make you look younger, it's going to make life last longer, it's going to reduce pain and inflammation, even though it's not clinically proven, that people, when they hear that, are going to try and buy your product. This is disinformation, because you're falsely creating a narrative on a medical product or health product that is currently not true. Anything that I prescribe has been trialed and tested on a number of different people. So studies show and back up that by hypothesis, the summary is this medication is bound to do this because that's how we found it to be useful. That's not always the case in products that people are selling on health online. And then you have other people with agendas who want to push their own beliefs, whether this be religious beliefs or just their moral beliefs, especially people when it came to the vaccine. And they didn't have the information on whether the vaccine would make you infertile or make you grow legs or whichever, but they put that out there on social media and on the internet for people to believe, knowing true and well that they couldn't factually prove this, know that they have any backing from it, and this can be deemed as disinformation.
Thank you very much, Dr. Okorocha. And Mrs. Onikan, do you have anything to add to that?
Yes, I do. So just buttressing what Dr. Okorocha had said. So yeah, definitely there are people who deliberately pass across disinformation, and for different reasons. For some of them, it may be because they want to make money, they want to get additional profit for their businesses. There are also people these days, especially now in the days of social media, where people want to trend. People want to be the first to be seen as the ones who broke the news. And so they come up with different news. You actually have people who sit down literally and manufacture news on their phone and pass it across on WhatsApp. And all of this information over time is spread severally. And then you can tell that there's an intent behind it. Now you find that very often, for example, in the space of politics, but and other spaces as well, where people just sort of sit down and cook up things and just to pass across information to people, but with an intention in mind, right? So yeah, definitely people do that deliberately, and it happens.
Yeah, thank you very much for using an example that's familiar, that I find familiar. That's the example of politics. Like, when I hear about disinformation and propaganda, I think politics. But from what you've said now, not only politicians like spread false news. Like it's also in the domain of health as well, and other domains, the financial domain as well, like Dr. Emeka mentioned. And Dr. Emeka, this next question, I would like to start with you. You know, you are a TikTok star, a social media influencer, a health influencer. And the question is, why do you think social media is a fertile breeding ground for the spread of misinformation or disinformation?
I think one major thing is accessibility. Social media is accessible for anyone of any age. You could be 12 years old, 11 years old, and if you have iPhone, you can go on social media and find your information there. You can be 50, 60 years old. And with the amount of people now that have smartphones, the majority of people will have some sort of access to a smartphone or have some sort of access to internet somewhere. And that means they have access to social media. The accessibility is spreading and growing, especially in developing countries. You're now seeing a lot of people now looking to social media. We know that it's a massive platform for entertainment. People love to be entertained, and it obviously spiked off during the pandemic when a lot of people were home and in their houses. And so the boredom, in that sense, pushed people to social media. And it's one of the reasons I actually went on TikTok to start informing people about what we were seeing in COVID. That was kind of my main goal when I first started it. And you can see just how big it's risen since then, and it will only get bigger. And so because of that, like anything, it can have its good and its bad. It can be a blessing and a curse. So it could be a very good platform for people who are giving reputable information about your health in a number of different ways. They can make it funny, they can make it entertaining, they can make it watchable. But at the same time, because anyone can access it and anyone could go make a video and say anything, you will have people going to push their agenda, whether it be financial or moral, talking about misinformation and disinformation based on what they believe or what they want to say.
That's very thoughtful. Thank you very much. And my next question will be for Mrs. Onikan. I would like to draw from your experience as a behavioral health and communications specialist. And nowadays, it appears that conspiracy theories have become one of the most dominant health misinformation trends on social media. What are some of the factors that enable the spread of these conspiracy theories, Mrs. Onikan?
Thank you for that question. And the truth really is that today, information is pretty much democratized now. People now have access to a lot of things that they can get information from. People now have access to the internet at such a large scale that was way more than people did in the past. Many years ago, when there's a problem or there's a pandemic or anything, or there's a disease in the community, you would have maybe an incidence manager or the Commissioner of Health or somebody from the Ministry of Health go on radio or go on TV or in the papers to sort of explain or clarify what the disease is, whether it's Lassa fever or whatever is a disease in that particular area. And you would have people, just get their information from there, and that sort of helps to authenticate the kind of information that people were getting. But today, anybody can post anything. Anybody, like literally now, everybody has access to a mobile phone, and everybody, people want to trend. People want to be the first to break the news. So even before the Ministry of Health gets a chance to go on radio or go on TV or, officially announce certain things, you find people who are like social media influencers who are already sharing this information. People are already taking videos, people are already taking pictures and coming up with information, and then just sort of sending that out. So that has been like a problem. You're also having communities where they don't necessarily have access. If you go up north, for example, in northern Nigeria, you have communities where there's no internet access. There's no, there's information that it's really challenging. And many of the times the people that get information from the health workers, they get information from the community leaders, from their religious leaders. And so, so those sort of people become such strong partners in passing across information if properly utilized. So for example, in some of the projects that I'd worked in the past, we found that in some of these communities where they don't have access to social media or access to TV or things like that, we know that they have access to radio, right? Yes. We know that they would go to the mosque. We know they will go to the church. Some people who, for example, wouldn't go to a health facility to give birth to their babies for whatever reason, for different reasons. But they will go to a traditional birth attendant to have their babies,
Yes.
for example, because there's a level of trust that they have with the traditional birth attendants or with the imams or with the pastor. And so on projects that we had worked on in the past, for example, we decided that are there ways that we can collaborate with these institutions that are already trusted, that are already known in the communities. And we had to sort of wrap around our campaigns that way, where we started to develop resources and various communication materials. We started to have advocacy visits to these trusted leaders, and sort of even had like training sessions with them, capacity building sessions with them to sort of help them to get the right information, because we then know that for the rest of the community members who may not have access to the TV or the typical medium of information, they would listen to the traditional leader. They would listen to the health worker, things like that. So just continuing to then work in partnership with those people, we found that has helped greatly in the past. So communities where, for example, there were myths around breastfeeding, or there were myths around polio, or things like that. We found that working with these community leaders and trusted people at community level and building their capacity helped us to achieve a lot of results. Then you had people who could now reach out to this local trusted people and then get right information, unlike in the past. So it's pretty dicey, but there have been ways that we've been working around this, at the local level in Africa, to ensure that we're passing across the right information, regardless of the challenges of getting proper information.
Thank you very much for that very insightful response, Mrs. Onikan. Dr. Emeka, anything to add about conspiracy theories, health conspiracy theories in Africa?
Yes, I think a lot of African conspiracy theories come from like passed down generation by hearsay. And if you look at the background when it comes to especially like religion in Africa, and a lot of the things that are still practiced today, you still have witch doctors practice in the day, you still have native medicine, you still have native witchcraft practice today. And a lot of the stories you even hear, and they're propaganded into movies in Nollywood. You see people turning into snakes and chickens and vultures and all this kind of stuff. And a lot of people will use that as basis of fact, unfortunately, because that's what they know. That's all they know. They've been passed down stories of this. We still have our traditions, our cultures, masquerades, and all that kind of stuff as entities. And this gets passed into healthcare by osmosis, and people still use a lot of old folktale remedies and whatnot. And there's still a lot of conspiracy theories about stuff to do with your healthcare. And if you take this, you'll be cured. And if you take this, you'll be cursed. And a lot of it just doesn't have any fact. And I think we need to move a little bit into the modern world, away from some of the old religious and cultural beliefs when it comes to healthcare, and make informed decisions based on stuff that we have research for, that we know that's going to help. We know that a lot of people who didn't take the COVID vaccine for whichever religious or cultural reasons, a lot of them have passed on. And when it comes into religion, me being Christian, the Bible will say, my people perish because of lack of knowledge and ignorance. And that lack of knowledge is the knowledge that we as healthcare workers are trying to learn and trying to develop every day to teach people. Like, this is the way, these old times where you used to use this and you used to use salt and these kind of herbs and go to a witch doctor and ask for prayer and sacrifice. That's not how things are done now. And so that's how I think a lot of the African conspiracy theories develop and are passed around them by word of mouth and social media.
Thank you very much for that response. And I'll also like to stay on this question for a bit. I'd like to ask Mrs. Onikan, as Dr. Emeka was responding to the question, what came to my mind is, it appears there is a relationship between culture and tradition on the one hand, conspiracy theories, and then health misinformation on the other hand. Why is culture so strongly tied to health information?
Elias, in Africa, we're very religious people, and it would be almost futile for any healthcare program to want to take out religion and say, oh, you guys don't listen to that, it's all bullshit, it's old stuff and all of that. But I do hear you, Dr. Emeka. I totally understand where you're coming from. But we found that no matter how much we tell people that, don't visit these places, don't do this, don't do that, they probably wouldn't listen. They still go anyway to this doctors. They still go anywhere. I gave an example initially of healthcare, of women who are pregnant, who you would ask to come to the health facility to give birth to their babies. But no matter what you say, they will still go to the mission houses. They will still go to the traditional birth attendants to have their babies. And regardless of the kind of things that the birth attendants would do to them, they would sort of soak that up and just continue to access. And then somehow that's, my grandmother gave birth at a traditional birth attendance place. My mother gave birth to me at a traditional birth attendance place. So now it's my turn. It's our family thing. Everybody gives birth there. And, there's this elderly woman in the village who is the one who has also, she's been the one taking care of all the babies. And so you have those passed down information, and it's so ingrained. It's so strong. I mean, you need to go up north to hear some of these things, right? And even down south as well. However, having worked at community level and seeing that we can't totally eradicate this institutionalized people that the people trust, right? Can we work with them? Can we leverage on that trust that the people have built? Can we build their capacity and pass across information, the right information to them? So we found that has worked greatly, where we then train them on what to do when mothers come to you, when they want to have babies, when there are complications. You should, as a traditional birth attendant, even encourage the woman to go to a health facility. If someone's placenta is not coming forth during delivery, can you put the baby to breast? And and let the baby suckle the breast, and that way it causes contraction in the uterus, and the baby would eventually be expelled from the womb. So but some of these things were not things that they knew in the past, and you could have cases where people would mix all manner of concussions. The baby is not coming forth. Okay, they keep pressing the woman's womb. They keep doing all sorts of things, trying to mix all sorts of things, and then you find cases where the baby dies, or the baby there are complications, and then at the last minute when they rush the baby to the health facility, and after everything that has been happening in the traditional birth attendance place, the baby then dies in the health facility. Then there's information again in the community. Oh, the health facility, they always kill babies. Oh, they always have, when you come there, they'll tell you that it's CS, so they won't do normal delivery, and then, but people would not say that, oh, but the woman had gone to a mission house. She'd been in labor for so long. She had gone to the traditional birth attendant. They had tried all manner of things and turned and pressed, and yet the baby wasn't coming before they brought the baby to the hospital. And now there are complications. What else would the health worker do? They're scrambling at that moment to save the life of the person. So some of these structures are ingrained in the way we work, across Africa. But then we may not be able to totally take off the structures, but then can we work with them? Can we build their capacity? Can we continue to pass across information in local languages so that the people then are able to understand the context and the information you're trying to pass across? So it's pretty dicey, but definitely there's a way around that, and we've been seeing progress over the years in across different locations in Africa.
Thank you, Mrs. Onikan. When we start talking about innovative solutions to health misinformation and disinformation, we will come back to that. But next, I'd like to go next to Dr. Emeka. When you were answering one of the questions, you did mention that the role that organization and international organizations, especially like the WHO, the CDC in the United States of America, and the NCDC in Nigeria, the kind of huge role, the vital role that they play in disseminating health information. But one thing that I realized, and many people as well pointed that out, at the height of COVID-19, there was some kind of conflicting information. I do remember specifically America's CDC. There was some conflicting information coming from them. This week they say something, and then by the next week they say something else. So does it mean that health organizations like certified health boards and international organizations, does it mean they are not prone to spreading health misinformation as well?
I wouldn't really call it health misinformation, because the information they spread at the time is what is known at the time, based on the knowledge they have and the research that they have. So obviously with COVID, during the pandemic, things were changing month by month, as in we had new variants, we had new treatment methods, I was part of something called the recovery trial, which we were doing here in the UK, where we were doing a number of different medications to trial on very sick patients who are requiring high flow oxygen. So one week, it may be that we think antivirals and fluids and excessive oxygen pressure is the way to beat COVID in the ITU. The next week may be completely something different. We tried and we thought there was a good basis on steroids. And then we started using dexamethasone and a lot of steroid treatment on people who were severe COVID ill based on the inflammatory response. So I think during that period, it was a lot, we didn't know a lot of information. A lot of the information that CDC, the PHE and the WHO give is information that's been backed up and used for a number of years. So it's kind of stable. During the pandemic was a little bit of a different time because it was a virus that none of us had really seen before. So we were discovering new things about it every week, every month. And so things were changing. We had the different variants, and we had the Delta variant, and then we had the Omicron variant, and they all affected different people and different age groups differently. So one minute you might see the Delta variant is affecting people worse over the age of 60, 70. Next, the Omicron variant is affecting younger people and giving milder symptoms. So there was a lot of information which could have been interpreted and seen as conflicted information. But it was kind of what we knew at the time, because even us as doctors working on the COVID wards, we tell our patients one thing, 2 weeks later, that may be old news. And that's why I think it was important for us on social media to try and keep up with what the CDC was saying, what the WHO was saying, what the CDC was saying, what the PHE was saying, and week by week give updates for our followers to be like, okay, so now we know this is the new variant, this is the new trial, this is what we're doing, and keep people updated based on what we know, because we're all going at the same pace at the same time. There were a lot of concurrent trials being trialed as we were treating people. Trials were going on as we were trying to treat COVID. So obviously information was coming up, new information was coming up based on the results of a lot of these trials. And that's why it may have seemed like, oh, it's information this day, and then the next is information that day. And it came across that way, but it's really more of the development of the research, if anything, that we were doing for COVID during the pandemic.
I mean, that clears up a lot. It makes me put a lot of things in perspective. Yes. And Mrs. Onikan, anything to add to that?
Sure, yes, I do. So you had cases across the world where, the developed countries had, you had cases where, for instance, certain countries will, bought over a large supply of COVID vaccines. And that sort of created an inequity in vaccine distribution across the world. And I would say that the region that was mostly affected by that inequity was Africa. You had countries, let's say the US, for example, or Canada, or other developed countries where they had large doses of the vaccines, but then other places where people they were hearing information that is COVID, and for some people really wanted to, in Africa, for some people they really wanted to get access to the vaccine, but the vaccines were not available. And like they say, there's no, when there's vacuum, there's always something to fill it, right? So we're not getting enough information. Or we're not even getting access to the vaccines and things like that. And people start to come up with different things. Or maybe, the vaccines are, maybe they are making a special vaccine for those abroad, and then we in Africa, they're making a special one for us. It's not our turn yet. Or maybe or maybe there's something they're putting in our own vaccine that they are not putting in theirs, and that's why it's taking some time for our own to come. And eventually, when vaccines were eventually brought in to a lot of countries, and people started to have different ideologies around why they shouldn't take those vaccines, or maybe they want to reduce our population, or maybe there's something that, but all of these are caused by these gaps. And Dr. Emeka, you were talking about, the whole COVID season there's a lot of research going on. People are acting based on the information they have as at that point. But in other parts of the world, like Africa, they didn't really understand. They didn't really understand that. They just felt like, okay, why are we not getting our vaccines and things like that? And it started to fuel misinformation and disinformation across the space. And even vaccine hesitancy. People didn't want to accept the vaccine by the time the vaccines were eventually brought in. You also had cases where even though the vaccines were eventually brought in, people still were quite concerned about the quality of what exactly was in there. They would say, oh, are we sure that the vaccine they're giving us here is original? Are we sure that is something, and all of that, stories that people were passing across. So it's interesting how what happens in the West sort of trickles down to what eventually happens in Africa. Look at when, for example, Trump had his strong opinions about the COVID vaccine and how many people across the world were affected by that. People didn't take the vaccine because Trump said so, right? So and that's just one example. There are many other celebrities who, for example, refuse to take the vaccine, even up to now.
Exactly.
There are people who still haven't taken the vaccine, and that has sort of affected places like Africa, where people see these people in the West as like role models, and they look forward, they look up to them, and so that has also trickled down and affected how people are responding to COVID. Unfortunately, up to now, there are people who still haven't taken their vaccines, and it's something that is work in progress. We're continuing to see how to pass across the right information there.
Yeah, thank you very much. And one connection that I see between Mrs. Onikan and Dr. Emeka's response is that health information or healthcare itself evolves, from time to time. And as those information evolve, the kind of information that comes out about healthcare as well has to evolve to keep up with the evolution in the health sector. And my next question, before we switch gear to discussing solutions, is the World Economic Forum did mention that health misinformation is one of the major threats to our society. And especially in Africa, what kind of debilitating effects do you think health misinformation and disinformation might have on healthcare as a whole in Africa?
Me personally, I think it could be very, very, very dangerous for Africans, especially because of the way our culture is. Like Ms. Onikan mentioned, the way Africans, especially Nigerians, can be stuck in their ways when it comes to culture, when it comes to religion, and you're only going to believe what you see has been passed down to you. This is why it's really, really difficult to get people out of their general, misinformation cycle, where misinformation is completely passed down. And like you said earlier, Ms. Onikan, a lot of these people aren't misinforming people on purpose, but this is what they believe to be true. And just because they believe it to be true doesn't necessarily mean it factually will be true. And like you said, a number of people haven't gotten their COVID vaccine because of misinformation they've heard and the way that we think in Africa and in Nigeria. And this can have tremendous consequences. This can have fatal consequences. You see that COVID can go and kill a person who hasn't been vaccinated, and they haven't been vaccinated based on misinformation they may have heard from somebody even close to them, such as a family member, who's obviously not intentionally trying to harm them, but unintentionally does. And that's why it could be catastrophic in Africa. And it's really important that we really try and seek methods now to tackle misinformation and get true information out there so that Africans, just like a lot of people in the West, can be making informed decisions about their healthcare, which is going to help them, not hurt them.
Over to you, Mrs. Onikan. Thank you very much, Dr. Emeka. Those are great points.
Yeah, so the first effect I would say to start with is the obvious one: death. People are dying every day because of wrong information, because they are not accessing the correct information. When we started, we talked about people who had said in the past, oh, if you want to cure Ebola, if you want to cure COVID or whatever, drink salts and water, add salt in your water to have your bath. Maybe take it in the morning and in the evening or whatever. You had all manner of ideologies around different diseases and how people think that you should cure those diseases. Growing up in a place like Nigeria, it was commonplace to find people on the bus who would sell drugs to you, or just at the street corners, and they would have this one drug that cures everything. Right. And they tell you, if you buy this drug, it will cure headache, it will cure tuberculosis, it will cure everything, like literally HIV, everything, staphylococcus, and all of that. And, and they would take megaphones and actually spread this information, and people would come by and all of that. So the first thing is people take these things, there are deaths, there are complications, there are people who are coming down with like kidney failures. And I imagine those who have high blood pressure who had actually gone ahead to drink salt water. And that's increasing their the blood pressure, and people actually dying as a result. Unfortunately, in Africa, rather than then agree that it was the misinformation or things like that, then we start to say, oh, maybe it was somebody from the village, it's the village people that killed the person. Or, even when there's COVID and people are truly dying from COVID, you then have cases where people say, no, it's not COVID, it was just malaria. He just, he just had a brief illness. I know we just, oh, he died after a brief illness. But then we don't clearly say that it was COVID. Or even when people know that it was COVID, they sort of just cover it up. And then you hear things like, oh, COVID is for the rich. It's a disease of the rich. Because when I remember, very often you would find, in Africa, when people started to die, you would have records in Nigeria specifically, for example, the people who you would see on the TV or on the news that were dead from COVID were usually the high profile people. And those at the local level, there wasn't much news about them, but people were dying from COVID. People were dying from these things. So it's interesting how the misinformation affects people locally across Africa, but somehow we don't admit that that's what exactly is happening. We sort of have a nice way to cover it up and have our myths and ideologies of what killed the person, and it's not necessarily this big disease that we're all talking about. So those are like some of the effects, and definitely it's taking a huge toll on the healthcare system. There's a lot of work that needs to be done, that is being done already, but that work is ongoing, is continuous, and that's the place of just ensuring strategic communications, coming up with plans, coming up with clear messaging to address this misinformation, and not just in English language, right? But in the local languages, in a way that people understand, and not just health workers telling that message, but also passing across that message to the people that the community members trust to be the custodians of the information. That way, they are not hearing the right information just from the community health worker. They're hearing the right information from their religious leader or the community leader who they trust a lot. So it's definitely something that is ongoing. But there are lots of effects. But there's a lot of work that can be done to address those effects.
Thank you very much for that, Mrs. Onikan. I really like the way this discussion is unfolding, but for a lack of time, we would have to round up. I would really love for this not to end. I would like to discuss this with you both, for hours on end, because you both are seasoned experts and professionals when it comes to health information and healthcare, public health, and other things healthcare as well. And my next question now, I would like to switch gears to talking about some of the solutions that we can adapt or adopt to combat health misinformation. And starting with you, Mrs. Onikan, because when you were discussing, you talked about the relationship between culture, tradition, and health information. And my question is, how can we turn that around? How can we leverage our cultural and traditional practices to promote health information?
Good point. There are ways that we can leverage, the what we currently have existing. We can't totally eradicate the cultures. We can't eradicate the systems that exist completely, but we can see how to work hand in hand with the structures that exist to then ensure that we're strengthening what is. It might take a while for people at the really grassroots level to fully come to terms with, for example, coming to a health facility, and not always thinking about the money first, right? Before coming, because some are like, oh, I don't have money. So, rather than come to a health facility, they'd rather go take leaves in the bush or go to a chemist or a pharmacist and just quickly buy anti-malaria, buy something. They sort of self-diagnose and then go buy things based on what they think is wrong with them. So it's also then just seeing that these things are real and they exist, but then let's see how to leverage, So are there ways that we can build the capacity of these folks who work at the chemist? Are there ways we can work with alongside this pharmacists, local pharmacists, local traditional like I said, traditional birth attendants, or the people that people respect at the local level. Other ways as well, even the media, where this conversation is happed around the media, right? So even journalists, like just building capacity of journalists on the kind of information they should be passing across. We find that journalists are they're quite trusted, they write for papers, they write for the TV, they write for radio, and etc. They also have social media platforms, and lots of people follow them and get information from them. I imagine those who, for instance, work in the health space and are journalists, those are people that we should also be building capacity, right? It's not just enough to assume that because people are educated and they went to school, they sort of know what is right or what to do, but just sort of building their knowledge and providing them with the right information. So again, back to strategic communications and some of the materials that we've developed. So for example, the Ministry of Health, for every country really, the Ministry of Health, you have materials that have been developed on different health matters, depending on what exactly is happening in that country, whether it's Ebola or it's Lassa fever or it's COVID or HIV and AIDS, etc. You have resources that have been developed, so it's just continuing to sort of strengthen the capacity building that have been ongoing, working with these different actors, these different stakeholders that the people would listen to and regard highly, just continuing to build their capacity and providing them with these resources. So it's not just enough, for example, to train them, but it's also important to give them these materials, and then they can sort of use those flyers, leaflets. We have cases where we produce jingles, yes. In different languages, right? So it's just continuing to strengthen that. These things are ongoing, but in Africa, that's something that we need to continue to strengthen, continue to increase. There's also the place of, again, there's no vacuum in nature, right? So when something comes up, if the appropriate authorities don't pass across the right information quickly, and as soon as possible, people will cook up their own stories. And like we said, WhatsApp, very quickly, if someone just sits and types something, and before you know it, it's forwarded several times. and that becomes the story that people are spreading around. So authorities also need to pick up some pace there. I know that we're trying to make sure that we have the right information and, the research is right before, we then go on TV or radio, on Twitter or whatever to start to pass across information. But we should definitely have some, steady messaging in place that, once there's some information spreading about, for example, monkeypox, right? Can we then have some steady messaging to send out to people as quickly as possible, so that before people start to spread the wrong ones, So there are many ways, especially I feel like now we're starting to go into what we can do to address it, but there are definitely many things that we can do around the culture and everything that exists. We can't totally scrap them out, but we can find ways to continue to build and leverage on what exists.
Great points, Dr. Onikan. And for Dr. Emeka, the same question, but I would like to twist it a little bit. These old cultural and traditional practices, and how can we fuse them with the new methods that you were talking about the other time, so that both can work in tandem to help the promotion of health?
That's definitely going to be a task. I think the first thing is addressing and identifying all the old cultural practices that we still use in Africa, especially Nigeria. So, because each different culture and each different part of Nigeria, it's a very diverse place with different languages, different religions, different culture. Each different part of Nigeria will have their own culture and will have their own background. And the North, they'll have a different culture to the people in the South, and the people in the East will have different culture to the people in the West. So we need to identify and address the different cultural practices when it comes to healthcare in the different parts of Nigeria. Following on from that, once we've addressed them, then I think we can tackle them in different ways. I don't think it's going to be a case of one size fits all when it comes to a country like Nigeria, because then you have the tribalism and the culturism where the people might say, no, that's the South. It's an Igbo man trying to sell his this. Oh no, you're a bad guy. He's not talking anything. You're about people. And then you get into different debates there, especially when you look at how politics go in Nigeria and how the system is set up. It's a bit of a united but divided country. So I think it's going to be a place of setting it regionally and culturally, attack people from notable areas who are respected in their communities, thus bringing information, correct information, which they may gather from people like us and governing bodies, and then spreading it to their own people. Like you mentioned, having jingles in different languages, when you could personalize something in a language that somebody can understand, it's going to increase their capacity, because not everyone can speak perfect English in a country like Nigeria. A lot of people just get by on pidgin English or speak their own native language in the village or in the city. And so we need to address that in itself. They may not understand completely, especially when it comes to medical jargon and a lot of the medical knowledge. Even people who speak perfect Queen's English won't understand some of the information I give them if I give it in a medical type of way. So delivering information in a way that people can understand is one thing. And then tying it in with their own culture and their own cultural beliefs and backgrounds is another thing. So like I said before, when a lot of people from where I'm from are from a Christian background, especially from the East and the Southeast, from Christian and Catholicism. And so you need to understand that, yes, the Bible says this, this, and that. But the Bible says, my people perish because of lack of knowledge. When Jesus was talking about lack of knowledge, and the Bible said lack of knowledge, some of it is this. Then people's eyes might open, people's eyes will clear, and they'll be like, okay, so this is part of this is God giving people knowledge and giving people the ability to do research and to help themselves, and for us to give you that information. So it's not thinking about times of back. Even throughout the Bible, you can instant times where health practices changed and cultures changed and stuff they did in the church changed from the Old Testament to the New Testament. There's a lot that changes. There's been change from then till now. And so if you can relate that to people of that culture, they might understand it and think, okay, maybe this is just a change in the new way forward. Maybe we don't need to always revert to our old cultural practices of going to Amadioha, the witch doctor, or whatever. You know what I mean? It's not always what we see in Nollywood. Sometimes that stuff's just done for film and fantasy. The same way some of these movies you see in Hollywood in action, it doesn't always happen in everyday America. Just because you see Hollywood is science fiction. A lot of it's just made up. And I think explaining that to a lot of these people is going to be the task, and explaining culturally that culture develops. Like with anything, culture develops. The culture in the North will develop. The culture in the West, the South, the Center, the East, it will all develop. And I think the best way to do that is to get people of specific cultures to talk to their own people, because they'll be people they'll listen to. And Hausa man might not really listen to an Igbo leader, no matter what he says, just because of lack of trust. Same thing with Yoruba people and Fulani people and Ibio people and Ijaw and people from Warri and everywhere in Nigeria. It's such a big place. It's such a big country with so many different cultures. I think getting the information from one source, maybe the government, or obviously the WHO and NCDC, and then just delivering it to the different regions in the way that they'll understand from their own people. I think that's going to be the best way that people are actually going to start taking their healthcare seriously.
Excellent points, Dr. Emeka. And one question before you go, because I know we are running out of time. How can individuals like me who don't understand anything about medicine, I'm not a medical doctor, I'm not a public health specialist, how can we identify, in one sentence, how can we identify false health information?
The sources. Going for reputable sources. Believe none of what you hear and half of what you see. So anything you find, if you can't credit the reputable source and background to back it up, I wouldn't believe it personally. Even if it's true, it may be true. But if you can't back up the source of where it's come from, if it hasn't come directly from a health professional who you know is a board certified health professional in that area, or it hasn't come from a board certified reputable source, I wouldn't believe it. Just that as a blanket, and you're likely to be following the correct information.
Follow the source. Thank you very much. Mrs. Onikan.
Yes, I would say that be very wary of any sort of information that elicits strong emotions, whether it's positive emotions or negative. Be very wary of information that have sort of extraordinary claims about certain things. There's, information that speaks to your biases and especially those that are not properly sourced, just like Dr. Emeka said. So it's also important that when you get information and you sort of see these pointers, you're using your common sense and it's not adding up, you're wondering if this is actually correct, then go and check, right? Cross-check online, cross-check with reputable organizations, check on WHO website, follow them on Twitter, follow them on, on different media platforms, and actually get authentic information. Follow CDC for your different country, the Africa CDC, the Nigeria CDC, the dependent, the CDC at your different countries. Follow them to actually get authentic information. And every time someone sends something on WhatsApp or wherever else, cross-check. to be sure that it's correct, check the dates and things like that. Just be sure before you then forward to other people as well.
Excellent. Thank you very much. And finally, before we go, Dr. Emeka, how can we reach you? What are your social media handles?
Oh, yeah,
We want to follow you.
You can follow me via Instagram at dr.doctor.emeka, Dr. Emeka. The same thing on TikTok, where I release a lot of my informational videos. And then on Twitter, dr.doctor_Emeka. And if you put the same thing into Facebook, I have a professional page there and also a YouTube link there. So if you go on any one of those platforms, there'll be links to the other platforms, and that's where I normally do my my information giving. Or on LinkedIn, if you type in Dr. Emeka Okorocha, my full name, then I'll come up.
Nice. Thank you very much, Dr. Emeka. And Mrs. Onikan, how can we follow you?
Sure, I can be found on LinkedIn and on Twitter. I'm simply Wemimo Onikan, and I'm right there. You can connect with me.
Yeah, thank you. I can't thank you enough for the gems and the wealth of information that you have passed across today. We really want to appreciate you for being a part of the conversation, for being a part of Engage Africa Foundation. And we believe together we'll be able to make Africa a more healthy and a more prosperous nation. Thank you very much.
Thank you so much for having me.
Thank you.
Nice to meet you.
Nice to meet you.